All right, so today we're going to briefly talk about verbal fluency. So, verbal fluency is the ability to freely generate words, subject to some restrictions imposed by the examiner, and within a well defined period of time. So, it's a timed task. Importantly, verbal fluency is a test of both language and executive function. It is not simply a test of language in isolation, despite what you might reasonably assume from the name verbal fluency. In that context, then, we probably need to disentangle it a little bit from how we use the word fluency when talking about language more generally. For example, in the context of assessing someone's language, or perhaps identifying the non-fluent variant of primary progressive aphasia. I suspect it's because of the intrinsically hybrid nature of the task of verbal fluency as depending on both of these domains that motivates some commonly used cognitive screening instruments to actually give verbal fluency its own section altogether. For example, in the Addenbrooke's cognitive examination, verbal fluency is its own subsection and it's not lumped in with the language section of the instrument. I like to compare the task of verbal fluency by analogy to the task of finding and opening Word documents arranged into folders on a computer. Yes, clearly you need language in order to read the words contained within the Word documents, but a critical part of the task, and sometimes the rate-limiting part of the task, is your ability to efficiently search and sift between the various folders regardless of how they're organised, and that reflects the executive component of the task. Broadly, there are two types of verbal fluency. Firstly, we have phonemic fluency, which is also known as letter fluency, because in this task, a person is given a letter of the alphabet and asked to generate as many words as they can in the space of 1 minute, beginning with that letter. And the most commonly used letters in everyday practice are the letter P, the letter F, the letter A, and the letter S. This part of verbal fluency is more heavily dependent on executive functioning rather than language functioning, although again, it's still a deeply hybrid task. And so this is more sensitive to pathologies, for example, affecting the frontal lobes. The other kind of verbal fluency is semantic fluency, which is also called category fluency, because in this task, a person is asked to generate as many exemplars belonging to a particular category that they can in the space of 1 minute. And most commonly, that category is animal. That is, the person will be asked to generate as many animals as they can in the space of a minute, although sometimes some other categories can be used as well. In contrast to phonemic fluency, semantic fluency is more dependent on language function than executive function. Again, it's still a deeply hybrid task, but as a result of that, it's slightly more sensitive to pathologies affecting particularly the mesial and anterior temporal lobe. I'll briefly mention the COAT, which is the Controlled Oral Word Association Test. This is what neuropsychologists will use when they're rigorously assessing verbal fluency during their assessments. The COAT includes 3 measures of phonemic fluency, that is with 3 different letters, as well as animal fluency. In the clinic, though, we don't usually have time to do that, and typically we'll only do 1 letter and 1 category. I would encourage you, though, to always do at least 1 of each. Even though there are some screening instruments that only use 1, I'll always try and supplement it with the other as well. For example, the MOCA, the verbal fluency section of the MOCA, only assess phonemic fluency, but I would routinely also do semantic fluency with animals as well. And hopefully the motivation for that will become clear shortly. Let's talk about actually giving the instructions for the task. So here I've got a screenshot from the instructions for phonemic fluency in the Addenbrooke's cognitive examination. Typically, I would say something like the following. In a moment, I'm going to give you a letter of the alphabet. I'd like you to tell me as many words as you can beginning with that letter in the space of 1 minute. It can be any word you like. It just can't be the name of a person or a place, so no proper nouns. For example, if I gave you the letter T, you could say terrific, you could say tarantula, but you couldn't say Tasmania, and you couldn't say Tom. All right, are you ready? Your letter is P. Go. Next, I'd like to talk about actually recording verbal fluency and just some minor documentation tips. So this is now the screenshot of the whole phonemic fluency section from the Addenbrooke's cognitive examination. And firstly, I'd point out that there are 4 sections, 4 columns. Each of these columns is meant to represent 15 seconds in the 60 seconds that you're giving the patient. And so you should make sure your documentation of the words reflects that temporal dispersion. Additionally, I like to put little dots to reflect periods where the patient has blocked or has not said anything for a little while. And I think that's useful to help get an overall feel for the nature of the verbal fluency pattern. So for example, here we have a person who was able to quickly generate 4 words beginning with P, then there was a brief pause, they got another word, and then there was quite a prolonged block before the person said the next word, which was person, but this was one they'd repeated before, so that was accompanied by a cross and a notation designating that as a repeat. Then the next word was Peter, which is a rule break because that was against one of the rules that was given at the outset. So again, that's denoted with a cross as well as RB to denote that it was a rule break. Then they managed to get off a few more words, another brief pause, another few words, a very brief pause, and then 2 more words for a total of 12 P words, excluding 1 repeat and 1 rule break. In the Addenbrooke's cognitive examination, the result of 12 P words corresponds to the 11 to 13 range, and so they scored 5 out of 7. So I suppose now we should briefly talk about normal performance. So helpfully, in the Addenbrooke's cognitive examination, there are some ranges, so you can get a sense of what normal performance should look like. And when someone has verbal fluency tested in the context of a rigorous neuropsychology assessment, they will be able to much more robustly compare to statistical norms the person's individual performance. But as clinicians just in the clinic doing this less rigorously, it's more useful to have a general sense of what is a normal or a grossly abnormal verbal fluency. As a very general rule of thumb, it's probably useful to remember that the average 10-year-old should be able to get 10 P words. I think that's a useful yardstick in everyday practice, and also brings into mind the fact that, for example, on the mocker, a normal to obtain the score 1 out of 1 for the verbal fluency section, a person only needs to be able to generate 11 or more F words. Now, that's actually only 1 more than the average 10-year-old. So it's worthwhile keeping in mind and always documenting what the exact number of words generated was, not just the score for the particular instrument. So I'll finish up by talking about interpreting verbal fluency. What do we make of it? Well, firstly, I'll mention that, we should look at the general patterns of verbal fluency rather than just impaired or unimpaired. Obviously, we want to know what the overall number is. But if we see semantic fluency much more affected than phonemic fluency, then we're thinking more of a language type problem. Whereas if we see phonemic fluency affected much more than semantic fluency, we're thinking more of a dysexecutive problem. It's also important to pay attention to those rule breaks and repeats. If there are very many rule breaks, then that's a soft dysexecutive feature. In contrast, if there are very many repeats, then that might be consistent with an amnestic profile if the rest of the cognitive testing is consistent with that. Now, of course, don't overweight just a single rule break or a single repeat, but certainly you do notice that if someone repeats the same word several times, particularly if they don't realize that they've done it, that can be pretty suggestive. Another particular pattern that you will occasionally see is that when the task of animal fluency is given to a person after phonemic fluency, in the Addenbrooke's cognitive examination, that would be with P words, as we've seen, sometimes they might actually revert to giving you words that start with the letter P, even though you've told them that they can give you an animal starting with any word, any letter. In the right clinical context, that could be suggestive of a degree of perseveration. They're perseverating on the previous task. Lastly, I'll briefly talk about something dubbed semantic fluency regression. So, as I mentioned before, the average 10-year-old, as a general rule of thumb, should be able to generate 10 P words. Another useful rule of thumb is that semantic fluency should, broadly speaking, be about 5 better than phonemic fluency for most people. That difference, that is being better by 5 in semantic fluency compared to phonemic fluency, is sometimes referred to as the semantic fluency gradient, at least informally. It's also known as the semantic discrepancy. And we can actually see it here reflected in the scoring on the Addenbrooke's cognitive examination. This is the scoring section for phonemic fluency for P words, and you see that you obtain the maximum score of 7 out of 7 if you're able to generate more than 17 P words. In contrast, in order to get 7 out of 7 for animals, you need to generate more than 21 animals. I'd encourage you to give the task a go yourself, and you'll start to notice immediately how actually semantic fluency feels a little bit easier. And that's because every exemplar that you generate is semantically linked to another exemplar. But this semantic fluency gradient can be a useful thing to take note of when assessing a patient, because loss of the semantic fluency gradient, which some people might informally refer to as semantic fluency regression, can be diagnostically helpful. It depends a little bit on the clinical context, but semantic fluency regression, for example, might suggest underlying Alzheimer's disease as distinguished from, say, vascular cognitive impairment, if the rest of the profile and clinical presentation is suggestive of that. So I always take note of loss of the semantic fluency gradient and regard it as a soft diagnostic sign. Certainly, in some extreme cases, you can even have semantic fluency inversion, where semantic fluency performance is dramatically worse than phonemic fluency. So not only is the gradient gone, it's actually inverted. I might wrap up by talking briefly and in a simplified fashion about verbal fluency patterns in primary progressive aphasia. Although this is only a particular example of where verbal fluency patterns might be useful, and probably the less common context, it does highlight some of the things that we've been talking about. So in non-fluent variant primary progressive aphasia, phonemic fluency is much worse than semantic fluency, although both are down. And that reflects the fact that in non-fluent variant primary progressive aphasia, the site of maximal atrophy and site of the pathology is particularly in the frontal lobe. In contrast, in semantic variant primary progressive aphasia, semantic fluency is much worse than phonemic fluency. Again, reflecting the fact that in semantic variant PPA, the pathology inside of maximal atrophy is centered on the anterior temporal lobe. Lastly, in logopenic variant primary progressive aphasia, both phonemic and semantic fluency are down, although neither quite as bad as in the worst counterparts of non-fluent variant and semantic variant, and they're somewhere between the above. We will, of course, have some more dedicated videos on primary progressive aphasia more comprehensively at another time, but I thought I'd just introduce that idea briefly. I'll just finish by mentioning a few caveats when it comes to interpreting verbal fluency. Firstly, as I've probably mentioned before, again, there is nothing pathognomonic in cognitive neurology. Verbal fluency can be a very sensitive measure for detecting cognitive impairment, but it's important not to overweight the specificity of anyone's performance, particularly when taken in isolation. There is, of course, also the usual caveat regarding people with non-English speaking backgrounds, especially if you're not using an interpreter to assess verbal fluency. And then lastly, I'll caution people to be aware of attentional blocking. Verbal fluency is a task requiring sustained effort and attention. If, for example, someone is extremely anxious, that might result in them experiencing a significant attentional block due to their anxiety in the middle of the task. And it's important not to overinterpret such a performance as representing, say, for example, severe executive dysfunction because of that attentional blocking. So there you have it. Verbal fluency is a hybrid task relying on both executive and language functioning. There are two types: phonemic or letter fluency, and semantic or category fluency. Phonemic fluency is more reliant on executive functioning than language functioning, and especially reflects pathologies involving the frontal lobe. The average 10-year-old should be able to mount 10 words. Semantic fluency, in contrast, is more dependent on language function than executive function, and is especially susceptible in pathologies involving the mesial temporal lobe. And in general, a person should be able to mount 5 more animals than they can P words, reflecting what we've called in this video the semantic fluency gradient.